COVID-19 vaccines and booster shots have been available for adults and teenagers for quite some time now. However, it's only recently that the vaccinations became available for the nearly 20 million children ages 6 months through 4 years. And while many parents and caregivers have been eagerly waiting to get their young kiddos vaccinated, there are many who have concerning questions. Today, we're exploring the topic with a local Stanford pediatrician and getting answers to parents' questions regarding COVID vaccines for infants, toddlers, and preschoolers.
Joining us for this timely topic is Dr. Esther Ramirez Cepeda. Dr. Ramirez is a board-certified pediatrician and a fellow of the American Academy of Pediatrics. In 2008, she founded Summer Pediatrics to serve the diverse population of the city of Stanford, including the underserved population. In addition to being a pediatrician, an entrepreneur, administrator, and a community educator, she's married and the mother of 3 beautiful children herself. And we're fortunate to have her here today to talk to us about the youngest age group to gain access to the COVID-19 vaccine. Welcome, Dr. Ramirez.
Thank you, Nola and Lori, for having me and for talking about this very important milestone in our journey through this pandemic.
Yes, it's so important for families to have answers to the question, and we're grateful that you're here. And to get us started, although many parents and caregivers and guardians have been waiting for a vaccine for younger children, they also have so many questions. So, Dr. Ramirez, can you tell us which manufacturers of the COVID-19 vaccine have been authorized to be administered to young children?
Currently, we have 2 vaccines for emergency approval, which is the Moderna and the Pfizer vaccine.
Good to know. Well, as we mentioned, it really wasn't until recently, in fact, this June, that vaccines were even approved for kids ages 6 months through 4 years. And so we have a 2-part question for you. First, for those parents and guardians who are asking themselves, why should I give my child the COVID-19 vaccine? What would you say to them?
I give all parents my recommendations, which is in line with the CDC and the American Academy of Pediatrics, which is that giving your child the COVID-19 vaccine is safer and more reliable way for them to build protection than getting sick with the COVID-19. The known risk of the COVID-19 vaccine and possible severe complications such as long-term health problems and hospitalization outweighs the potential risk of having a reaction from the vaccine itself.
Well, that's good to know.
Yeah, that's very important.
Yes. And my second question is related, and maybe you just need to reiterate, but with COVID-19 still relatively new and the vaccine just recently being approved for this younger age group, could you just confirm, is the vaccine really safe?
Yes, I definitely can say it is safe. And I know that parents are very concerned because it's a new vaccine. But before this vaccine has been approved, scientists have been studying all the viruses and also having rigorous testing for the vaccine for many years. So we can actually feel confident that your child is going to take something that is currently proving to be safe for them. Also, the vaccine is still undergoing continuous monitoring and the most intensive safety monitoring in the US history, actually. So we are not done.
Wow.
Can you clarify for us, is the same dose being used on kids 6 months through 4 years that is used on kids 5 and up?
No, smaller doses and needles are used for kids in the younger age group. So if you get the Moderna, you'll get 2 doses. And if you get the Pfizer, you'll get 3 doses. They are a smaller dose on both vaccines. So it doesn't matter which one you decide to take. Both of them are much smaller dose for the kids 6 months to 4 years.
Perfect. Dr. Ramirez, for all the parents, caregivers, and legal guardians interested in getting their child vaccinated, where can kids in Stanford get their vaccine?
Currently, the vaccine for kids aged 6 months and up are available in all the free clinics, and you don't need an appointment or insurance to get yourself or your child a COVID-19 vaccine. You just have to visit the stanfordct.gov for the vaccine clinic schedules.
Well, that's great to know.
I also will recommend that if you have any more question as a parent, to call your child's doctor. They can answer the questions and make sure you get all the information you need.
That is great. If parents, caregivers go to the free clinic, is there somebody who can answer their questions there as well?
Each of the nurses that are giving the vaccines are trained to answer any questions that the parents have. I also encourage parents to let the person that is going to give the vaccine know if there's any allergies or medical problems that they're concerned before the vaccine is administered.
Yes, that's very important.
Good to know.
Thank you, Dr. Ramirez, for joining us today. We are sure that parents throughout Stanford feel more confident about COVID vaccines for their little ones, thanks to your expert information.
And listeners, as a reminder, all the free clinics here in Stanford have the vaccine for kids ages 6 months and up. You don't need an appointment or insurance to get yourself or your child the COVID-19 vaccine. Just visit stanfordct.gov for the vaccine clinic schedule.